People are asking if uterine fibroid is treatable, and this will lead us to today's topic. We'll be talking about the treatment of uterine fibroids. I've done a video on what uterine fibroid is, as well as the signs and symptoms of uterine fibroid and the misconceptions that people have when it comes to uterine fibroid. So today we'll be looking at the treatment options of uterine fibroid. When a woman has uterine fibroid, these are 4 different treatment options that can be given to her, depending on when it is being diagnosed. So the first one is lifestyle changes. I will tell us what happens in lifestyle changes as a form of treatment for uterine fibroid. Then the second one is the signs and symptoms that this woman is presenting, so determine the next line of action that will be given to her. Then the third one is the use of medications. The last one is the surgical treatment. Then in surgical treatment, we are also going to look at what or at what stage will a woman be before surgical treatment will be suggested for the treatment of her uterine fibroid. So just note these cardinal points before I go into details in each of them. When it comes to the surgical treatment of uterine fibroid, there are some things that have been taken into consideration. Please, I would like us to pardon me. The marker that I got is behaving somehow. They are still new. So I'm sorry if you're not seeing what I'm writing here. So when it comes to surgical treatment, one of the major things that are being considered is the parity of this woman. By parity, we mean like number of children that this woman has. Is she a nulliparous? Nulliparous is a medical term for a woman that have not given birth or conceived before. Then multigravida is a woman that has given birth to up to 4 to 5 children. Then the final thing that will be considered is, does she have any intention of giving birth? So if a woman has uterine fibroid, before you can talk of surgical treatment, these first points must be considered, because it will help them to know if the surgery should go ahead or if the surgery shouldn't go ahead, or if the surgery should go ahead, what type of surgery are we going to, when are we going to do it, and what's the rightful time to do it for this one. In fact, the second thing that is considered is the position and the size of the uterine fibroids. The position of the fibroid and the size of the fibroid in the body of the woman is one of the things that will determine the surgical treatment that will be given to her. That is the type of surgery that she will receive, or if she will actually go in for surgery or not. Now, I made a diagram here to show us the diagram. This is a diagram of a normal uterus. This one is a diagram of a normal uterus with no fibroid. Then this one is diagram of a normal uterus, the uterus with fibroids. So from these two diagrams, you can see that in a normal person, in a normal woman's uterus, like where there is no fibroid, this is how it's supposed to look like. Please pardon my board and whatever I'm trying to show us, but this is how the normal uterus of a woman is supposed to look like. Maybe I will attach a well-labeled diagram for us to see this one. Now, look at this normal uterus. Now, look at this one that has uterine fibroid. Now, these are different types of uterine fibroids. We have the intramural, the intramural, the subserosa, the submucosa, and the penducated fibroid. So these are different fibroids that you can see in the body of a woman. Now, this is talking about the position. This circle stuff, they are talking about the position of this fibroid. Okay, this one is the ovary, sorry. This is the fibroids. These are fibroids, different types of fibroid. So the position of this fibroid, as well as the size. Yes, there are some fibroid that can be as big as this, my hand joined together. Then there are some that can be as big as my head. Then there are some that can be so tiny, very small. So it depends on the size of the fibroid of this woman, as well as the size of the position of the fibroid, and sometimes the number, how many the fibroids are, that will determine the type of surgery that will be given to her, or if this woman will need surgical treatment. So someone that has big uterine uterine fibroid within the cavity of the uterus or outside the uterus, and someone that their own is just developing, you just know that even from common sense they are not going to receive the same treatment. Rather, they can be treated by the symptoms that they present. But this is just to show us that, just like some women think that, oh, because I have fibroid, that it must be surgery. No, you need to present to your managing team first. Let them find out what type of fibroid you have. Then if they find out the type of fibroid you have, they will also note, in fact, from the type, they will know the position. Then the next thing will now be the size. How big or small is this fibroid, and how is it disturbing you? So these are the two things that will be taken into consideration before any surgeon will consider taking you into the operating theater for surgical removal of your uterine fibroid. So let's now talk about different types of surgery that can be done for a woman that has uterine fibroid. When it comes to the type of fibroid, type of surgical treatment that are given to these women, the major or the most commonest one is myomectomy. Hysterectomy is also a surgery whereby there will be a partial or total removal of the uterus. Then the fourth one is the laparoscopy surgery. It is a form of not cutting the skin of the woman, like it is only a small incision that will be made in her abdomen or in her belly or in her pelvic area. Then a machine will be used to view the uterus, and the fibroids will be removed. Now this will bring us, when it comes to this hysterectomy, I forgot to talk about age as one of the things. Age as one of the things that is being considered before a woman is considered for surgery. So as age, like I said, age. What is the age of this woman that already has fibroid? When it comes to age and hysterectomy, then they will consider how old is this patient, how old is this person. Is she 18, 20, 21, 22, 23, or like the age of the person will determine, are we going to remove the uterus? Removal of the uterus, what of the advantage? Does the advantage outweigh the disadvantage? They will look at it. For someone that is not yet married, for someone that is still single, in some occasions where the advantage outweighs the disadvantage, then they can go ahead and remove the uterus of the woman. So the second or the major treatment option is the signs and symptoms she's presenting. We determine the next line of action. Remember, I said always in my video that not two individuals are treated the same. So one of the major or the classical sign that most women with uterine fibroid present with is menorrhagia. Menorrhagia is a medical name for excessive or heavy menstrual flow or menstrual bleeding. A woman presents with menorrhagia, she's having her period, and the period is so heavy. Not just that it's heavy, it also comes with clots, thereby making her to feel weak or to feel dizzy, and other symptoms that comes along with menorrhagia. So when a woman presents with menorrhagia, the first line of action will be to do something to stop the bleeding, number one. And one of the things that can be done to stop the bleeding will lead us to the next one, which is also the use of medications. There are some medications that can be used to stop the bleeding. She can also be given what we call some family planning pills, like combined contraceptive pills, to help stop the menstrual flow at the moment, in order to help this woman to get herself from excessive bleeding. And the second one is when it comes to signs and symptoms, if this woman who is already bleeding has gone to the level of becoming anemic, if she's already anemic, anemia is just a medical word for when of the blood in that person is already low, is beyond or below the normal range. There are ranges for the women, and there are also some ranges for the men. So if this woman is already anemic, then you know the first thing that should be done is to bring her out of her anemic state before the next form of treatment. If she's anemic, the next line of action or the treatment that will be given to her, first of all, she may be hospitalized. Then she will get blood transfusion. She will be transfused the appropriate blood in order to boost her blood level. Then if the anemia, or if it is not the severe stage of anemia, her meal plan can as well be reviewed. Then there are some medications that can be given to her to also boost her blood level. Then going to the third one, someone may not present with menorrhagia, another person may not present with anemia. The symptoms they may come in with may be pain, severe cramps. So if this woman is having excessive cramps or excessive menstrual cramps and she is in severe pains, the first line will also be to give her medications to tackle her pains. If she's having excessive pain, the next thing that will be done is to help to relieve this pain. Pain is the fourth vital sign, so it's essential that someone shouldn't be in pain while you are talking about surgical treatment and the rest. So if she's in excessive pains or if she's in chronic pains due to excessive cramps that come from her menstrual flow, then she will receive some medications to help tackle the pains she's having as well as to relieve it from her. Then the third one, I don't know whether you can see it well in the video, but the third one here is dehydration. Some women that have uterine fibroid, because of other symptoms that they are presenting with, they may be dehydrated. Because when a woman has uterine fibroid and is present on the bladder, making her to urinate often, sometimes psychologically she may try to reduce her water intake so that she doesn't go to the toilet always, without knowing that what is even making her to urinate often is not just because she's taking enough water, but because of how the uterine fibroid, the size or whatever, is present on her bladder. So some women may stop taking enough water. So if she presents with dehydration, then she will be given appropriate intravenous fluid to help her come out of her dehydrated state. So when it comes to signs and symptoms, you see why I said no two individuals are treated the same. So when someone with uterine fibroid may not show any symptoms, like we have the asymptomatic one and we have the symptomatic one. Someone may have uterine fibroid and she will not show any of these signs that I mentioned here, but the person still has uterine fibroid. Now, some other person may have uterine fibroid and all the symptoms I mentioned here will be presented. So depending on how such an individual presented, that will cause the next line of her treatment or how her managing team will draft her treatment. So the third thing, the third form of treatment that is given to women that have uterine fibroid is the use of medications. And when it comes to medications, although I've mentioned it when I talked about the symptoms, like I've mentioned some things relating to use of medications when I talked about treatment by the signs and symptoms that the woman is presenting. Now, I also mentioned in that one that some women are symptomatic and some are asymptomatic. So with this now, we use medications, that is the use of medicine or drugs like people call it. The first one is to control hormonal imbalance. There are some medications that can be used to control her hormonal imbalance, to control her hormones so that it will become balanced. So the second thing that you can use medications to do is to stop excessive bleeding. Like when I talked about menorrhagia, if the woman is already excessively bleeding, there are some medications that can be given to her to stop this bleeding at the meantime before other form of treatment will be initiated. Then the third one is to boost her blood level. This is another form of why medications are used. For someone that is already anemic or someone that is recovering from her anemic state, there are some medications also that can be given to boost her blood level. Now the fourth one also, the medications can be given to her to regulate her menstrual cycle, and this menstrual cycle can also come with to stop the excessive bleeding. For women that are having excessive bleeding as a result of their uterine fibroid, there are some drugs that can be given to them. One of the major ones that are being given to them is birth pills, like the controlled birth pills, or what we call them contraceptives. They are being given to the woman to control, as in the first one is to give her the medications to stop her menstrual flow for some time while she will be monitored. This is all about treatment of uterine fibroid with the use of medications. So in lifestyle changes, what happens in lifestyle changes as a form of treatment for uterine fibroid is that the woman will be sent to do, she can be sent to a dietitian, a registered dietitian, to help her make her meal plan, to help with her meal plan, to make sure that she's eating adequate and balanced diet meant for her body. Then exercise is also essential for people that have uterine fibroid. Then the third one is the use of supplements. There are so many good supplements that a woman can use in order to keep herself healthy as someone that has uterine fibroid before the major treatment comes in.